اوكي he will start now. انت شكلك مستعجل. He will start.
I
What is your
mean
station?
to go first, whatever the time.
So what is your station?
It is postpartum, 10 weeks pregnant, 7-month-old child.
Okay. This one?
Yes.
Okay.
No, I don't think this one.
Not this one?
No, it's postpartum depression. No.
Your station is postpartum depression?
Yes, postpartum depression.
Cuckoo is good.
Okay, you have 2 minutes to write down your notes, arrange your thoughts. Okay.
Okay.
I'm ready whenever you're ready, doctor. Okay. Okay.
All right.
Let's say that
So,
my name is Mrs. White. Okay, and you will be the doctor, and my name is Mr. and Mrs. White. Are you with me?
all right. Okay.
Okay. 1, 2, 3, go.
Hello, Mr. White. I'm Dr. Suleiman, one of the mental health doctors.
Hello, doctor.
Hello. I understand that you have some concerns regarding your wife, and I'm here to help.
Well, I don't know, doctor. She has changed. I'm very worried about her, and I would like to know more about what's going on with her.
All right. So, may I have your understanding? So, to start from what you already know.
Well, she has changed lately. She's very worried about her child. She's talking about that he has leukemia, and she has changed. She's not able to take care of the children, and she always feels hopeless. And I'm really worried about her. I would like to know more. What's going on?
Right. So, I've seen her and took her permission to speak with you. And from from the assessment, she seemed to having low mood, worries about her baby, and um, other symptoms suggestive of depression. And we call it postpartum depression. Have you ever heard about this term before?
What is this term? What do you mean?
Well, so it's basic a depressive disorder or a depression, which is mainly brought on by having a baby. And from the note, I see that you have a 7 months child.
Yeah.
So it's like it's expected maybe after within 1 year of having a baby, maybe to develop some depressive symptoms, and we call it postpartum depression. Am I clear so far?
Yeah, yeah. So, and what could be the reason for this?
Well, so again, having mental health difficulties could be related to different or various reasons. Like having a family history. Does Miss White having any family history of mental health problems?
No,
Okay. Um, Again, just having a baby can one of the vulnerability factor or increase the vulnerability of having depression. But as well, maybe if she's having any other ongoing stressors in her life, do you think there's something is happening?
no, no. She doesn't have any sessions now.
Right. I'm glad to hear that she doesn't have stressor. But again, having a baby itself can be one of the precipitating factors.
I see. So, well, how about any risk on the baby or on herself because of this?
Well, so from the assessment, we didn't pick up any risk. However, I would like to ask you if you have any concerns regarding her safety or safety of the children, of the child.
Well, yeah, doctor. She's not able to take care of the baby properly, doctor, and and I feel that the baby has lost some weight because of this, as far as the nurse told us this.
All right, I hear that. Well, so depression itself affect the person's ability to meet up his daily needs. So, and we will discuss more about how best we support her just and uh, look into this risky things and how would we manage.
So, but I'm just wondering if you are going to manage her, but well, what about the baby? You know, I work two shifts, and I'm wondering if she's going to be treated, and definitely she will be committed to a treatment plan. Who's going to take care of the baby?
Right. So, as you mentioned, there are some ongoing risk about the baby's not growing well. That's make our first priority to take her to the hospital or admit in the hospital so she can be admitted in a mother and the baby unit, and will be nurses just to look after the baby.
Okay, so well, do you feel that she's going to get better?
Well, so receiving treatment early and being in hospital, she doesn't have family history and doesn't have past psychiatric history or mental health problems. All these factors favor a good prognosis, really.
Okay, and then how can you help her then?
All right. So again, it's depend on level of risk. As we can see, some risk here. We can think of admission to a mother and baby unit. So there's a team to cover all her needs and the needs of the baby as well. We think of starting an antidepressant, like for example, sertraline. Don't worry about name. I will give you some more information about this medication. So start antidepressants to improve or lift up her mood, so she can engage well in the post in antenatal care and engage better in the service,
I see, I see.
right? So in addition to the medication, there are other options. Would you like to hear?
Yeah, yeah, sure.
Well, so once we start the medication, we can think about other type of support like token therapy or psychotherapy. And one of these therapies called cognitive behavior therapy. Have you heard
Mm-hmm.
about this before?
No, what is this?
Well, so this kind of therapy, it's known that it can be beneficial in depression, treatment of depression, and it's look basically into the thoughts and how our thoughts affect our emotions and our behavior. And again, it's well known to be effective in depression.
So, how can I help her, doctor? One
Or
minute
just
remaining.
coming today and asking about her condition shows that you are supportive and you are trying to do your best to support her. But knowing more about the mental health and help her just to engage in antenatal care and in treatment. I think this will be very helpful to her.
Okay.
Do you have any other questions for me?
No, time. How do you feel about what we did? How do you feel about what
So
we did?
I wasn't sure whether we should be hospital admission or start in community and start home treatment team,
Why?
because in this case we can.
Why you
Well,
feel that lady should not be admitted? Okay, she has postpartum depression. It is written that she has psychosis. The baby is starting to suffer. He is losing weight. She's not able to take care of him. Postpartum depression can be severe. You don't know what could happen. There is possibility that she might hurt herself, neglect her baby, or even do something for the baby. So definitely, and you were confused. You said that there is no risk, but because of the risk, we are going to admit her. It was a total confusion. Please, doctors, please, the outcome and of these management station tasks really require from you a lot of practice and preparation in order to make sure that you don't fall in these mistakes in the exam. First of all, doctors, now the Royal College perspective and orientation has changed, and please pay attention to this. They now focus on those who are engaging more with their patients and they have better communication skills and showing empathy and so on. You were very technical. You did not show any empathy in the beginning when I was worried about her. You just started, so tell me what do you know about her condition. He did not engage the lady, his wife, in your management. He didn't say that I'm going to talk to her, explain her condition, and so on. They like this. They like this, and the candidates who do this, they feel them that they are more palatable and more accepted in their culture and community. Maybe in your clinic you are very clever, but now we are playing a game called CASK, and there are some rules which you should follow. Okay. So in the very first beginning, when the role player is going to show, and in all the stations, pay attention, all the stations, the role players are instructed to show some particular sort of emotions. Either they are worried, they are angry, they are depressed, some sort of emotions, and they expect from you to show the reciprocal emotional reaction and to show empathy and so on. So pay attention to this. And this definitely the best time to show this empathy is in the beginning. You're not required to turn it into a psychotherapy station, but at least show some empathy. Okay. The etiology, please. We will revise the etiology. Now the risk, it was total mess. You didn't know whether it is risk or no risk. He said that there is no risk, but at the same time, you want to admit her.
So, doctor,
A
because
big
of the
mistake.
stem, the stem mentioned that you have assessed her and no risk for her and the babies. So that's why I
If
mentioned
you are
that.
if the condition requires her to be admitted to the mother and baby unit because she will not be able to take care of her child, okay. Formulation, please, doctors, please pay attention to the formulation. Okay. Uh, Antenatal care, pay attention to this. This can be considered as jargon. Antenatal care. What is antenatal care? This is not a term to say to someone who is out of the medical field. And please, doc, don't you think that this lady requires an antipsychotic?
Yes, if she's having psychotic symptom,
Did
but
you
she
did,
has worries about the child. So I'm not sure if this is
did you
psychosis or
mention an antipsychotic?
no,
Okay,
no.
okay. Pay attention. No problem to
Okay.
do these mistakes here. This is the place in which you can mess up as much as you can. No problem. But pay attention to these mistakes and try to work on them. So it's okay that everyone mess up and do all the mistakes here. This is just a practice. That's why we practice, in order to do mistakes and correct ourselves.
Yeah, thank you.
No problem. That's okay. It's your total right. And I really appreciate it because if someone is totally okay, there will no place to help other candidates. This is someone who's very good. So there will be no chance that we can pick up some particular mistakes which we will highlight. postpartum depression. So, Bismillah ar-Rahman ar-Rahim. So as you can see in this, the very first beginning, as you can see in the instruction, you are anxious. They are instructing the role player to be anxious. Why is that? To see your communication skills. Are you a doctor who is going to be empathetic and will be engaging with the emotional engagement, appropriate emotional engagement with your client, or just be a robotic, as if they are talking to ChatGPT regarding their condition? So pay attention to this. Pay attention to the communication skills and showing empathy in the very first 2 minutes. Okay. So the first thing is that you want to show some empathy. Okay. And more, there are many things, many sentences in which you can say this. Very important to explain that it is a comment is about 15%. 15%. These terms will reflect your professionality. You must say something which will show that you truly knows the postpartum depression in depth. Okay, and you must explain also that beside the depression there is also psychosis, and explain what is the psychosis which is associated with this depression. Unfortunately, you did not say this. You did not mention the percentage. So even if you did not say the percentage, there's no problem. But not saying the psychosis, which is clear in her condition, I think this is a very defective explanation according. What is the cause of postpartum depression? We have these biopsychosocial, psychological factors like having past history. Exactly. Like, who is doodling on this? Don't doodle in this on the screen, which increase the chance of developing it. Psychologically, you have psychological, physical, and social factors. The biopsychosocial paradigm, which we all know. So, which I think, but you forgot the physical, like cesarean section, complicated pregnancy, illness in the mother and baby, and so on. Is there any risk because of this disorder? Unfortunately, if left untreated, her mental state can be risky to herself, the pregnancy, and the baby. Now we have, okay, also the bond between her and the ex. So it is a risky condition. But who is going to take care of the baby? Definitely, this case need to be in a mother and baby unit. Is she going to get better? This is a question about the prognosis. And in order to make sure that she is going to get better, just ask him some questions in order to make your answer comprehensive. Ask about the social circumstances, the physical condition, and level of risk, and then say this paragraph, you can put it in any condition when you are asked about the prognostic factors. There are factors which favor the good outcome: early onset of treatment, absence of psychiatric history, etc. Absence of stressor, good support. However, we know that her mother had, well, if the history says that she has postnatal depression, you can say that this could be some factor which does not favor the good outcome. Okay, mention the good prognostic factors, the good and the bad, when you are asked about is she going to get better. How you can help her. This is the best place after this question this is the best place to put your formulation. Now, the formulation is very important. It will show your ability to pinpoint where is the problem, what are the points which you are going to focus on in your management plan. So now you know that she has postpartum depression with psychotic features and which holds risk on her baby and herself. All this in the background of having a family history of postpartum depression. However, she doesn't have any other psychiatric disorder, physical disorder, and she has good support. So the first line is simply the main psychological problem and the level of risk. The second line is simply the biopsychosocial background. Okay, this is your formulation. Very simple, but though it is simple, unfortunately, the candidates do not pay attention to it. And it is the very first point, which, and by the way, I maybe early, maybe 1 or 2 years back, I shared an article and in which the examiner have been asked why the candidates find it difficult to pass the management stations. And many of them, the main reason in most of the consultants that they said that the candidates are not able to formulate the condition of the patient. Okay. Now the management, when you reach the management point, you will only have around 90 seconds maximum, 2 minutes, 60 seconds. So you must be very organized when you talk about the management. So stepwise, what are you going to do, Dr. Mahmoud? What are you going to do and where the patient is going to be treated? You must talk with your patient. As I said before, they like the doctors who engage their patients in their management plan. They like the doctors who show empathy. Okay, 100% technical is not recommended in the COSC, and they don't like him, even if he is totally right. So what are you going to do and where the patient is going to be treated? You want to see her, explain her diagnosis, address her concern, assess the level of risk, okay? And definitely this lady needs to be admitted in a mother baby unit. Never talk about the medications without talking about the investigations. Again, doctor, you talked about the medications without paying attention that you must know the baseline of her physical condition before starting the medications. Okay? And say that she needs to do some blood test to make sure that she's physically fit for any medications. Okay, you have the psychological retreat, as you said, the perinatal team, which will cover all her needs, psychologically, socially, and physically. Psychologically, the medications are the backbone, particularly the SSRI group like fluoxetine. Also, she needs an antipsychotic, which is safe in pregnancy, like olanzapine. Physical, you must liaise with the obstetrician. Very important. This is a pregnant lady. So you must liaise with the obstetrician to plan for her pregnancy and the delivery and the stay in a baby unit after the delivery. Now, you have admitted the patient. You must mention what are the conditions of her discharge. Once her mental condition is stable and it is safe for her to go home, she will be discharged and followed up by a perinatal team at home. Are you with me, doctor? How
Yes,
can I
thank
help? This is a very common question. It is also a question which to some extent challenges your communication skills, his emotional support, and helping her to be committed to the management plan. Also, the feedback to the treatment team. All this will help in taking the right clinical decision. Okay, is it clear? Let's see the mark sheet, which is the main reference. It's not my notes, not any other notes. It's all about this mark sheet. Okay. So unfortunately, the first point you did not formulate. You did recognize the significance of findings and result that this lady has postpartum depression. Unfortunately, your management plan was lacking the antipsychotic, lacking the communication with the obstetrician, lacking the plan for discharge, did not pay attention to the patient's health view. You did not engage your patient in your decision. You must say, I will talk with the patient to make sure that she understands what you are going to do. Does not develop adequate risk management. You did develop adequate risk management plan. The psychological and social interventions, CBT, social interventions, unfortunately, did not talk about the perinatal team after discharge and the conditions of discharge. It was very formalic, you were very technical, okay, robotic. It was, to some extent, it was organized. Your communication skills need to be a bit improved. And unfortunately, though nowadays, though the communication skills are 6, but I keep getting a feedback from the candidates after receiving the results that they fail mainly because of their communication skills, not because of their technical skills. Okay, so pay attention to this. Thank you so much. I hope that you found it helpful. Thank you so much.
you, Dr. Hassan. Thank you so much.
Okay, who would like to go next?
Hello, Dr. Hassan. Me,
Hello,
please.
doctor. How that you are fine. So what is your station, doctor?
Refeeding syndrome.
Please raise your voice if you don't mind.
Okay.
What?
Refeeding syndrome.
Yes,
Refeeding
refeeding syndrome.
syndrome.
Okay, refeeding syndrome. Yeah. Okay.
May I know if the
Okay, let's say that
nursing
her name is Anne, and the lady's name is Michelle, and the patient's name is Anne. Okay.
Hmm.
I will start the timer
Okay.
now. 1, 2, 3, go.
Hello, Michelle. I am Dr. Muhammad, one of the psychiatrists from the mental health unit. I understand that you have some concerns regarding one of your patients, and I think,
Yeah.
and I am here to
Yes.
help you and address
Yes,
our
I
concern.
have been following Anne about 1 year, but in the past 2 weeks she has deteriorated. I don't know what's going on, and I would like to share with you her condition in order to see how we can help her.
Yeah, I am here to help you and address all your concerns. So, could you tell me more about her condition?
Well, her hands and feet became swollen. She's finding difficult to swallow. She's always lethargic and weak. I feel that her level of consciousness is not as good as before. I'm really worried about her, and I feel that the condition is not improving. It is deteriorating with time.
Really, this all made me worried as well. So, did you manage to take her vital sign?
Managed to take what?
Did you manage to take her vital sign?
Yes, her blood pressure is decreased. It used to be 100 or 60. Now it is 85, usually over 55. And I'm really worried because of that.
And are you aware if she's suffering from any medical condition?
No, no.
All right.
She's diagnosed with anorexia, and I'm following her. This is
Yeah, I did understand from my notes she's diagnosed with anorexia. So, was the GP saw her and assessed her?
no. We did for her some blood tests, and that's it.
And what about her result?
It only showed low phosphate.
All right. And as you mentioned that she has been diagnosed with anorexia nervosa, and I understand from my notes she gained 2 kilograms during only
Yeah.
1 week.
Yes.
So
Yes.
I was wondering, yeah, if she is following with dietitian.
No, but her mother is very helpful, and she is keen to make her take food as much as possible. That's why she gained weight 2 kilograms in 1 week.
All right. So, Michelle, from what we have discussed, it seems that Anne suffering from what is known as refeeding syndrome. Have you ever heard this term before?
What is this refeeding syndrome?
All right. It's a critical medical condition happening in patients who depend on fat as a source of energy for long period, as in patient with anorexia nervosa.
Yes.
Yeah. So those patients depend on fat for the source of energy, and this create chemical imbalance,
I see.
as you mentioned. Mhm. Am I clear so far?
Yes, yes, yes.
Mhm. So this lead to create chemical imbalance in her body and disturbance in body salt like potassium, phosphate, magnesium, thiamine.
I see.
Mhm.
Okay, I see, I see.
And
And why she is finding it difficult to swallow?
So when in phosphate decrease in the muscle, this lead to difficulty in swallowing.
I
And
see.
also this, as mentioned, this critical condition can make load on her heart, as you mentioned now, her feet and hand is swallowing, and that really made me concerned. So we need to transfer her as early as possible to A&E.
Okay. So how are you going to help her? So yeah, I want to know.
Hmm. So I want to highlight the most important point in her condition. So Anne has been diagnosed with anorexia nervosa for the last 1 year, and now she is suffering from refeeding syndrome, which is a critical medical condition and is risky to her.
Yes.
We will, yeah, I appreciate your effort if you help me to inform her family to brought her to A&E. Meanwhile, I will contact my colleague at A&E to help her, and I will assist her in A&E. Am I clear so far?
Yes, yes.
So once she reached to A&E, there is some investigation will done to her, like blood chemistry, heart tracing, and we need to replace all these electrolyte deficiencies, including thiamine.
I see. I see. I see.
Mhm.
Oh,
So the backbone treatment of her condition is stabilize her medical condition.
yes, yes.
All right. So once she become stable, she will go back to her community, and the
1 minute
multidisciplinary team will
remaining.
follow her. She will cover all her needs physically, psychologically, and socially. And the most important things, we need to educate her mother about her condition and to be followed up with dietitian, and she not need to be gain more than 0.5 to 1 kilogram per week, as is risky of her.
I see. I see.
Mhm. We can add psychotherapy in form of family therapy to educate all her family about her condition. And also the GB will follow her regularly.
Okay,
I
time.
hope I
How
am
did
clear
time,
so far.
time? How do you feel about what you did? Excellent, mashallah. From my point,
Mhm.
it's very excellent. So how do you feel about what you did, doctor? Very good. Any
So I am so far to manage my time all the time in this station.
Okay,
I am
no
happy to
problem. But
get.
you managed to cover everything. So
Mhm.
give and please give the doctor give it. Let's help each other. Give some feedback. The feedback of other colleagues is definitely very valuable.
Yeah.
So how do you feel about what you did?
I think I covered all the point. I'm not
Very
sure.
good. Yes, yes, yes. You are very.
Mhm.
It was very good performance, by the way. The best thing is that in the beginning you took a handover, and you must say it clearly. I would like to take a handover in order to take the right clinical decisions. So they did not bring in us for nothing. They want to see, do you know how to deal with this colleague or no? So it
Mhm.
was good that you thanked her for her interest in her patient. But at the same time, you must say that I would like to take a handover in order to take the right clinical decision. And the handover is simply the biopsychosocial information she needs to know and the level of risk. Okay,
Mhm.
that's it. And but the problem that you did not ask about her current weight. You
Mhm.
ask about the dietitian and you did not ask about her social life. And as I said, take the biopsychosocial information. Okay,
All right.
you started by the
Okay.
physical, and you forgot the psychological condition, like when was she diagnosed with anorexia? What about her current weight? Is this following? You said that you asked about the dietitian, but ask about her mental state because they might put other symptoms here. Yes, she might, it is a refeeding syndrome, but the Royal College can change the scenario. She might be depressed and so on. Ask about the social and the level of risk. Ask her verbally any concerns about her risk other than the physical condition. Your explanation of the diagnosis was very good. I don't have any comment on it. You did formulate in a very good way. And did you mention that all this? Okay. And then what are you going to do and where she's going to be treated? This is the medical emergency, so she must be transferred as soon as possible to the medical ward. You must say that I will see her there to assess her mental condition and discuss her condition with the physician. You must say what Dr. Abu Wafa is going to do. Okay, we are not here to discuss in general how to manage a refeeding syndrome. This is supposed to be a real clinical situation. So you must see your patient. It's very simple.
Yeah.
Definitely, must see your patient. Okay. You talked about investigations. Did you talk about investigations like blood electrolytes, kidney functions, liver functions, etc.?
I did.
You did?
I did. Yeah.
Okay. So there will be a team. Okay, so her medical condition will be stable, and after discharge, you must liaise with the GP. Psychology, you must follow her up regularly, etc. And then the social, very important, as we said, that you discuss with her family how they can help her in the best way, and at the same time, you must talk about the role of the dietitian. Termination, thank you for the, okay, if you had time, definitely you would have done this. Let's see, according to our worksheet.
Okay.
Okay, you did formulate, you recognize significance of findings and result. Your management plan was good. You did, no, you did not pay attention you didn't say that I'm going to talk with my patient. So unfortunately, point number 4 is not going to be scored for you. You did have a risk management plan. The psychological and social interventions were good. You said that talked about the family, the dietitian, and the psychological. So it was very organized, and your communication skills was good. For me, it is a very good performance. Pass or fail, not a pass. I'm not an examiner, but it was very good. Thank you so much, Dr. Rafa. Very clever. I hope that you found it helpful. Thank you so much.
Yeah, thank you.
Okay, who would like to go next?
Can I go next, doctor?
Okay, yeah. So well, yes, you are Dr. Ashwija. Yeah. So what is your station, doctor?
The one with the baby devil. Third one, postpartum psychosis, 4 delivery, 4 weeks. Postpartum psychosis, 4 delivery, 4 weeks, auditory hallucinations. The devil wants to harm her baby.
Postpartum psychosis. Okay, just let me. They are all delivery and they are like.
لا
This
انا ما
one,
اقدر
the lady who has been taking lithium and quetiapine. The lady who has been taking lithium and quetiapine.
Probably not that. Station number 3, probably.
Okay. They are not, for me, they are all ladies with mental health problems. What's the mind depression? Postpartum. Okay. This one, 26 years old, 4 weeks. This one, this one, dear. Is it this one, the 26 years
Yes,
old?
yes, yes.
Yes.
باقي هذه واللي بعدها.
Okay, ready?
Yes.
Let's say that my name Mr. and Mrs. Brown.
Okay.
Okay. You'll set the timer. When I say go, you will start. Let's say 1, 2, 3, go.
Hello, Mr. Brown. I am Dr.
Hello.
Ashvija from the mental health team. I'm really
Hello.
sorry to see that Mrs. Brown is suffering with mental health concerns these days. I'm here to answer all your questions.
Yeah. I don't know what's going on. She has changed, and I really want to help her, but I don't know what to do, and I don't know what's going on.
Yeah. So can you tell me more about what you understand about the problem?
Well, I want to know more because she has changed. She cannot. She's talking about the baby. It's going to be taken by the devil. She became very emotional, and she is very worried most of the time. And she's talking about voices talking to her to keep the baby safe from the devil. I just everything is messed up.
Yeah, right. So you told me that her mood is not all right, and she's seeing some things and hearing some things that are you are unable to. Before I can talk to you about what is going on, I have a few questions for you, please, Mr. Brown.
Okay.
So before the delivery, did she have any problem at all?
No, it was not a planned pregnancy, but there was no problem.
Okay. Any time in the past, has she had any mental health concerns?
No.
Have you observed any sort of mental or mood fluctuations in her before?
No.
Anytime being very active or anytime being very dull?
No.
Okay, all right. So apart from that, currently, do you see any behavior in her which can be risky to herself or the baby?
Well, yeah. I don't know. When she talks about the devil and the voices which she hears, definitely I'm worried.
Has she done anything that can cause a problem to the child?
No, not yet.
Okay. Has she ever told you something which suggests that she wants to end her life or so?
No.
Okay. Apart from this, I also understand that you've been a very supportive person. So are you available also to help her with
Yeah. Me
the
and her
childcare?
mother sometimes come, everything. We try to help her as much as possible.
Okay. And is she also regular with the with post-delivery services? Is she getting help?
Yes.
Okay, all right. So with whatever you have told me so far, Mr. Brown, it appears to me that she might be suffering with what we call as postpartum psychosis, uh, which can be of significant risk to herself and the baby. And you told me that she has never had such a problem in the past.
Yes.
So just to check with you, does anyone else in her family have this kind of mental health concern?
No.
Okay. And sometimes in difficult situations, people can resort to using alcohol or any other drugs. This question might seem odd, but is there any such substance use?
No.
No. All right. So this is a risky situation, Mr. Brown. Would you like to know how we can deal with this
But I
and
want
what
to
is
know
the
what
best
could be the
approach?
reason for this disorder.
Yeah, so Mr. Brown, basically, pregnancy can be a stressful situation for most women, and this is her firstborn. Um, and you told me that this was also an unplanned pregnancy. So
Yes.
all of this can be more stressful for her.
Okay. Well, could be there any risk because of this disorder?
Yes, it can pose significant problem with how she takes care of herself and the baby.
I see. And what is the difference? I heard that something called blues, postpartum blues. Is this is postpartum blues?
Well, so postpartum blues is one of the mental health concern that we have seen post delivery. This happens in around 50% of the women, but in this situation, it mostly gets better in like 4 5 like a week or so. It's spontaneously getting better, and most women just need some psychological support and not really medications or help. But
Okay,
here
so
in
how can you help her then?
So first of all, since I was talking to you about the risk in this situation, I feel that we need to address this risk, and I strongly
1 minute
believe
remaining.
that she has to be admitted to the hospital in the mother and baby unit.
I see.
First of all, we will be doing some investigations to ensure that she's medically fit to start her on medicines and to find out what other causes there could be for this problem. Then we can start her on medicines which can help with these beliefs that she has and odd experiences that she's going through.
I see.
We will also ensure that the medicines that she will be given are safe for the baby and they don't cause any harm to the baby because it can
I
be
see. So
secreted.
she nurse her child then?
Yes, she can nurse her child. We will be choosing the medications accordingly.
Okay. Time. How do you feel about what you did?
Initially, I think I was confused about where to go and what to talk about.
Did you prepare for this station? Did you prepare? And be honest.
No.
Oh, it's obvious. Okay, so let's see how can we help. Let's see how can we help. Okay, so this is the station, and let's see how can we help her. Pay attention to the following. You are using very long sentences. I think in every sentence you could have said not less than 1 to 2 seconds, and don't underestimate this, because if you are going to say 30 sentence or 35 sentence, this means that you would lose not less than 30 to 35 seconds in the station because you are using long sentences. And when the candidates use long sentences to explain what do they want to say, usually this reflects they did not prepare well. You showed empathy in the beginning, it was very good. And you gathered information. When you gather information, pay attention that you already have enough information regarding your psychological and physical condition. So what you need to know is that you want to know some social information as well as the risk. So you want to know how do they feel about the pregnancy, and then congratulate them, and then ask if there are any stresses and if there is any support, and finally ask about the safety. You ask too much questions about the safety, any concerns about the safety or the safety of the baby. That's enough. Enough. This is not a station of assessing the risk, but you must ask about the risk because definitely this will be reflected on your management plan. Explanation. Pay attention that you must explain what do you mean by psychosis. Okay. Okay, false beliefs, auditory explanations, and so on. And engage me. So did what I said make sense? Have you ever heard about this term before? You just explain the psychosis. Pay attention that you're talking to someone who doesn't understand. He's not a doctor, so make sure that he is following you. Okay? We did not say that it is around 1 to 2%. Those are most of the symptoms like low mood, false beliefs, and auditory hallucinations. There is no particular cause, as we said, there is no particular cause for any disorder, but there are some factors which increase the chance of having this disorder, like having a family history of mental disorder, the first pregnancy, complicated pregnancy, delivery, very young or very old ladies, and sleep deprivation, and there are hormonal and chemical imbalance. You mentioned only one reason, which is the stress of the pregnancy. Yes, it can be risky if it is not managed properly. If this question is common, what is the difference between it and the postpartum blues? It was a good answer, which you said. Around postpartum blues, around 50%, and it resolves within 5 days after the delivery. Formulation, unfortunately, you did not formulate, and the management again. You must say, what are you going to do, Dr. Ashwija, and what if the patient is going to be treated? If you are going to give your patient medications, make sure that they do blood tests to understand the physical condition to see if they are fit for these medications. We don't give the patients medications that's without knowing the background of their physical condition. Okay, and there will be, you didn't mention the perinatal team in a station of, I didn't hear it. You must talk about the team which will cover all the needs, physical, psychological, and socially. So psychological, there will be medications, the backbone of psychological management. Okay, like you will give her antipsychotic, which is safe for the breastfeeding. Regarding the psychological, also she needs talking therapy. If there is no improvement, you must consider the ECT. Okay, ECT. Are you with me, Dr. Ashwija? You have admitted your patient. Yes. You must mention the condition of discharge, stable mental condition, and level of risk is low. She's going to be discharged and followed up with a nurse, and to make sure that she is taking her medications. Okay. Yeah. I will not go through the mark sheet again for the sake of time, and also for the sake that, well, you did not prepare. So scoring what your performance, I'm sure that you can do better. Will be in vain. Okay. Don't you ever go to the exam without good preparation, particularly for the management stations. Please, doctors, don't do this mistake. Thank you so much, Dr. Ashwija.
Thank you.
Okay, who would like to go next?
Can I go next? I have some.
Dr.
Haytham.
Dr. Haytham?
Yes,
Okay, dear doctor. So what is your station, doctor?
my station about discussing management plan with the patient with 36 weeks pregnant. Pregnant. The sixth station. Discuss management plan.
Okay, let's see. They are all
36 weeks.
pregnant. Yeah, all pregnant. So
Sorry?
they are all look alike, man. Yeah.
Yeah,
Okay,
yeah.
station number
The sixth
6,
station, number 6,
36 week, pregnant,
6 weeks,
and
yeah.
2 previous puerperal attacks, afraid of.
Attack, afraid of.
Yeah.
Yes, exactly.
Yes. Okay. No. This one. This one.
Yes,
Okay.
yes.
So you have 2 minutes. Arrange your thoughts. Write down your notes.
Okay. You think I'm ready?
Okay.
Mm.
One. Let's say that my name is Michelle. 1, 2, 3, go.
Hello. Thank you. Thank you for seeing me. My name is Dr. Makki. I'm one of the mental health doctors working here today.
Hello, doctor.
I understand, Michelle, that you have some concerns. I'm happy to answer all your questions and to see how we can help you. Is that all right?
Yeah. Well, doctor, I'm pregnant now, and I had previously 2 attacks of puerperal psychosis few days after delivery, and well, the symptoms were horrible, and I needed to be admitted. And I really don't know what are my chances now. I want to know exactly if I'm going to suffer from this again.
Okay, yeah. Yeah, I understand really your worries, and I think you have made the right step to come here to discuss that, really. And I think uh, before answering your questions, just I would like to get some understanding of those episodes that you had in the past, so then I can see uh, on what way better you could be helped. So tell me a little bit, how severe were those episodes
It
in the
were
past?
horrible. They said that I must be admitted. That's why I was admitted every time, 2 times. I don't want to go through this again. I was
Okay.
very risky to myself and others. They said I must be admitted.
Uh, yeah. Sure. Even me, I don't want to go through these difficult times. And just I understand that you have been on quetiapine and lithium medication, and they were stopped one
Yeah,
year ago. Yeah.
Yeah, yeah.
You know why you stop the medication?
They said that I don't need them again. My condition is stable, and that's
Okay.
it. They said that
Okay. Okay.
I didn't
Okay.
continue them more than this.
Okay. Okay. Do you have a kind of follow-up with the midwives? They got your
Yeah,
pregnancy?
yeah, yeah. I'm following up with my midwife.
Okay.
Yes.
Do you have any medical conditions so far, apart from your
No, no,
health
no,
conditions?
no,
Are you on any medication?
no,
Okay.
no.
No. Okay, that's good. Just I would like to get kind of a picture of your support in the community. How well you are supported there.
Well, my husband is very supportive.
Mm, okay, 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 that's good. So coming back to your question, you've told me that you are really concerned about having another episode of postpartum psychosis, given
Mm.
that you had so severe episodes in the past. And you were treated before with lithium and quetiapine. I
Yes.
think you know that just uh, did you have any kind of side effects of those medication when you
No,
were not at all? So I think the best way to treat you is to try the medications that you were doing well with them before in the past, which were lithium and quetiapine. But there are some benefits and disadvantages of those medications. I'm not aware whether you know them or not, with those medications, lithium and quetiapine.
I see, I see. So
Mm.
you say that I might have another attack?
Yes, the risk is very high. Really. It's range from 50 to 80% in the case because you have two previous episodes. It will be in the higher limit, 80%. Yeah. So we have to do something in terms of treatment, really.
Okay.
Okay. Okay. Okay. Uh, so in terms of treatment, definitely will be followed up by perimental health team.
Yeah.
Uh, and we are going to start you again on quetiapine and lithium tablet.
So do you think that this can be harmful on the baby?
Yes, yes. Lithium is harmful, particularly in the early month, but now you are at 6 weeks. So it is unlikely that you will get any kind of birth effects of lithium.
What
Just
about
we need
quetiapine?
uh, quetiapine is safe during pregnancy, safe medication. Uh, but when it comes to lithium, we need to monitor the lithium level very closely every week
I
if you
see.
accept if you accept starting lithium medications. But after delivery, we have to
Okay,
be
can I breastfeed my child?
with lithium. The guidelines do not recommend breastfeeding when taking lithium because
Okay.
it transmits in the milk and into the baby, and the baby might have kind of serious effect
Okay, so
with the lithium.
what support can I get then?
I think in terms of support, you will get the support of the health visitors and the mental health team who are going to support you closely and plan for the delivery and after delivery. Uh, so, for example, we you will be the delivery will be in the hospital in the first place, and all the
Yes.
team, the care plan will involve all the professionals, the psychiatrists, the mental health team, and the obstetricians and midwives, and even the gynecologists. Yeah. They will all
One
be on
minute, 1 minute remaining.
the same, will all be on the same page. So uh, when you are about uh, to get delivery, we have to stop the lithium if you are taking lithium in 24 hours, and then assess the lithium level after 12 hours. Okay. That depends on you if you want to go to lithium. And after delivery, your mental health will be followed closely with the mental health team.
I
And
see.
then if you want breastfeeding, you will stop the lithium as I told you. But if you wanted to continue to lithium, you can take lithium at
I
that.
see.
But without
What will
breastfeeding.
happen if I became unwell again after the delivery?
In that case, we appeal you to a mother and baby unit. Yeah,
Okay.
because you need support to yourself and support to the baby.
What will happen if I go to labor before my cesarean section date?
This is a good question. I think there will be a care plan for you in terms of emergency. So if you had labor before time, there will be a plan to contact the emergency services and contact the mental health team and the physician will know what to do at the time. Does that
Okay.
make sense? Does that make clear?
Thank you. Time.
Oh,
Okay. How do you
thank
feel
you
about
very
what you did?
much. 75%.
Okay. So please give our good doctor some feedback and please pay attention to the following doctor. Can I do the next station? Okay, Dr. Lamia will be the following doctor. Avoid the word of community. They consider it jargon. Try to be more fluent, doctor. Try to be fluent. There are a lot of pauses. You are using sometimes long sentences. Try to be direct to what you want to say. Try to use shorter sentences because you only have 7 minutes. I know this can be something related to your language, which is not related to your technicality. You definitely are very experienced, but at the end, I did not say the time except after giving you 1 more minute, maybe 90 seconds. Okay. You took long time to start the explanation, so pay attention. After gathering the information from me, it is expected from you to explain what's going on. And instead of explaining what's going on, what is the problem, you went into the management. Pay attention to this. You can refer to the record. I will post it on my YouTube. There are no 100% safe medication. You can always say that this medication, whether quetiapine, fluoxetine, olanzapine, is relatively safe in the pregnancy, or recommended to be given in the pregnancy. And again, you did not formulate. The last 2 questions about what about going to into labor before the cesarean section, and these questions, I will see with you how we can answer these questions. It is written in the.
I think I replied.
Okay.
I gave you answer. I said you have.
Yes, you gave answer, but it could have been better. I understand that you gave the answer, but it could have been better.
Yeah.
So let's see. Again, doctors, when you go to the management plan, always you must have this structure. Don't go to the management plan without having a stepwise approach in order to make sure that you are going to finish this task. You only have 7 minutes, so it will be a chaos if you expect to finish the task without having a stepwise approach and going randomly through any thing which comes up in your mind and thinking that this will help you to finish the task in 7 minutes. So our plan is to introduce ourselves properly, and it is a very important step. And though it is a very important step, many candidates do not know how to introduce themselves. Sometimes they forget the name of the patient, sometimes they forget the name of themselves, and sometimes they forget to say why they are talking with the patient. So the simple rule of the introduction is to mention your name, grade the patient with his name, and explain why are you talking with him. Then gather the biopsychosocial information and risk, not in the sense of full history, but in order to make sure that you are going later on to gather the information which will help you later on to set the formulation and set the management plan. Then do your explanation, and then formulation and management. The formulation and management, definitely they are following each other. The explanation or the gathering the psychosocial information, they can interchange their positions. But definitely you must start by the introduction. Definitely you must terminate with the formulation followed by the management. Sometimes you can start by the explanation. Sometimes you can start by the gathering of the biopsychosocial information and risk. As you can see, it needs some dynamic approach from your side, and that's why management plan needs some practice. So you gathered the biopsychosocial, very good. Did you ask any concerns about her safety and so on?
No.
Very, very important, because it's all about the risk. I don't think anyone will pass the station with a management station without showing that he is a practitioner who is keen to make sure that his patient is safe. So you must ask about the risk, any concerns about her safety. Does she use any recreational drugs? And by the way, these are the places where the Royal College can put some tricks. Don't expect that you will have a 100% copy-paste scenario like what you are having in my notes or any other source. The Royal College either can put some changes in the scenario or can bring a totally new scenario. But the management's task is the same, and your approach will be the same, always the same. So understand your concerns, okay, and then gather the biopsychosocial, psychological. What was the conditions of your previous admissions? Were there any concerns, medical or some? Your safety, not your, not her, okay? And the social condition and the level, and as we said, the level of risk, not your, yeah. Okay. Then your explanation must be very brief and very simple. The puerperal psychosis, you must mention it verbally that it can be up to 80%, particularly if there are previous attacks. Okay, and as for the medications, you must mention that because she is in the 36 weeks and the baby is fully developed, taking the medications will not affect the development of the baby. However, it is very important to stay in the mother and baby unit after the delivery. Did what I said make sense? Definitely, the previous medications which helped her are the recommended medications. And this is the answer for the questions. What are the medications which are recommended for me? What are the effects of the medications on the baby? Lithium definitely is safe in the 36-month, but still you must mention that there are some reports about having some effect on the heart, particularly if it is given before the first 3 months. Okay, though this is a point of controversy, but up till now, nobody said that this is 100% not accurate. So you must mention that it is safe in the 36 week. However, if it is given in the early 3 months, it can affect the development of the baby. Don't need to go through the details, which are now controversial regarding whether lithium is safe for the development of the baby or not. Okay, can I breastfeed the baby? It was a very good answer. That is not recommended because it goes through the milk. Unfortunately, did not formulate. Formulation is simple, and it is a very simple skill. Just show the examiner that you understand what are the points which you are going to focus on in your management plan. So this is a 36 weeks old, 36 weeks pregnant lady, risk of developing puerperal psychosis, and this carries risk on herself and the baby. All this on the background that she has been admitted before twice, and she has good level of support, and there are no underlying medical disorders. Simply, the first line you mentioned the main psychological problem and the level of risk. The second line are the main important points in her biopsychosocial risk profiles. Now, the management, what are you going to do, Dr. Hassan, and where the patient is going to be treated? So because of the risk chance of the relapse, there will be a nurse which will follow her up, and also there will be a frequent follow-up in the clinic to follow her physical and mental states and to address her concerns. So she will follow up with you regularly, and also there will be a nurse who will follow her up. However, at the same, you must mention that at any time, if there is any risk, you must consider the admission. Okay? Now, because you are going to give her medications, as we always say, never give medications without knowing your patient's background regarding her physical condition by the investigations to make sure that she is going to be fit for the medications. Okay? So the first thing to talk about is where the patient is going to be treated and what are you going to do, Dr. Haytham. And then step number 2 is talking about the investigations. And by the way, these are always the stepwise approach in my notes, just to make sure that in the last 90 seconds, you're not going to be confused. You know exactly what to do, and you will be very organized in the last 90 seconds in order to finish the most important points in the management. So as we said, number 2, investigations. Then you must mention the perinatal team, and which will cover all physical and psychological and social condition. The physical condition, as you said, there will be obstetrician which will follow up her condition. Psychologically, the best option, as we said, the lithium and quetiapine, and the level of lithium will be checked, and the dose will be adjusted accordingly. Okay. However, before the delivery, you must mention that the lithium will be stopped, and the plasma level will be checked after the last dose by 12 hours, and to adjust the dose accordingly. Okay. So, however, say that before the delivery, the lithium will be stopped, and then we will reinstate it. What will happen if I become unwell again before the delivery? Okay, rest assured that this probability is planned for. You will be closely followed up by the perinatal team for early detection of any relapse of or early signs of relapse. That's why you are following her up by a nurse, and that's why in the very first beginning you said that if there is any concerns about her safety, she might be admitted. Okay, are you with me, Dr. Haytham? Everything is clear?
Yes, yes.
Okay.
Yeah.
What will happen if I go to labor before my cesarean section date? Also, these two questions come in this station, and the candidates get confused about how to answer them. Say that you will give her contact numbers for the emergencies and the crisis team. See, crisis team. And please inform your obstetrician about your mental health needs, the medications, and the need to stay in the mother and baby unit, and the need to contact your perinatal team. Okay? So you will guide her about what to do if her labor comes before date. You will give her contact numbers. She must talk about her condition to the obstetrician regarding her mental health needs, the medications, and the need to stay in the mother and baby unit, and the need to contact her perinatal team. Okay? Okay. I will not go through the mock sheets again. I think all of you understand the importance of these mock sheets. Okay, thank you so much, Dr. Hay. Thank you so much.
Thank you, Hassan.
Thank you. Who would like to go next?
Can I
Dr.
go next,
Lamia.
please?
Yeah, Dr. Lamia. Okay.
Yes.
So what is your station, Dr. Lamia?
Post-MI depression.
Okay. Okay, so let's see. This is a very famous station. Okay, ready? Let's say that the
30
student's name
seconds.
is Michael. Student's name is Michael. Okay. My name is Michael. We will start now. 1, 2, 3, go. I cannot see
Excuse me,
you.
what's the name of the nurse? I
So
don't know. I opened my.
Are you sure?
Yes, but I don't know why it's not working.
I send a request to open the cam. Try
It's
to open the
open.
cam, please. Try to close it and open it.
Okay, I am. Okay, maybe I leave and enter again.
Okay, no problem. We will wait for her just a few minutes, please.
I think it's working now.
Okay, very good. So what's the... Okay. We will start the...
The name of the
diagnosis.
patient, Michael, and the name of the
My name
nurse
is
is.
my name is the patient's name is Michael, and let's say that is Mr. Gray. The so the patient's name is Gray. 1, 2, Mr. Gray. Okay, 1, 2, 3, go.
Hello, good morning. I'm Dr. Sadani, one of the psychiatrists working here. Mr. Gray. Am I talking to
No,
Mr. Gray?
no, I'm student nurse. My name is Mike. Doctor, please focus. The student's nurse is the one which you are going to talk to and discuss with him the condition of your patient whose name is Mr. Gray. Okay, do you get the scenario? We repeat the station again.
Excuse me, the nurse name is Mr. Michael
No,
and the patient is Gray.
there is okay.
The opposite. Okay.
One, two,
Okay.
three.
Hello, good morning. I'm Dr. Sadani, one of the psychiatrists from the mental health team.
Hello.
How may I address you, please?
You can call me Michael.
Hello, Michael. I understand that you have some concerns about Mr. Gray's condition.
Yeah, I want to know what's going on with him. I read that he has heart problems, but he's not following at all. And it is said that he is not participating in 2 sessions and missing his scheduled sessions. And also the GP in the note said that he has low mood. And it also said that the GP has referred him to the mental health services. And I would like to discuss with you his condition, if you don't mind.
Okay, thank you so much for coming and talking about this. So Mr. Gray, I believe he is a 55 years old male who's recently has a MI, a myocardial infarction, and then he's been released to the community for rehabilitation program, but unfortunately he is coming back today with symptoms of low mood.
I see. Oh, so what is wrong with him? Why he is not engaged in the rehabilitation program?
Well, according to the information that we have, that we are thinking that maybe Mr. Gray have what we call post-myocardial MI depression, and but we need to be more further assessment for that to make sure about this, Mr. Michael. Yeah.
I see. So, well, is it a common problem?
Well, unfortunately, it's a common problem for people who are suffering from myocardial depression. There were a 20% chance for them to develop depression after the incidents. Yeah.
Could there be any other reason for his low mood?
Well, there is, of course, there could be in other reasons for his low mood. It could be some stressors. Maybe he's having a past history of depression as well. It could be related to the MI. We are not really sure about this right now, but of course, it could be some medical as well, like hypothyroidism, maybe. We're not really sure about that yet. Yeah.
So how can the myocardial infarction cause depression?
Well, this is a good question. Myocardial depression, myocardial infarction and depression is related to each other for many ways. Like myocardial infarction, that it could have some insult in brain. So it could be this insult having with the areas of brain responsible for our mood. So maybe this is one of the reasons that people who's having myocardial infarction suffer after that with depression. Is it clear, Mr. Michael?
And can depression cause myocardial infarction?
And the depression itself, of course, can cause myocardial infarction for many ways as well, because the state of depression itself is a state of what we call a hypercoagulopathy, which is increasing the risk of the strokes and MIs, and also the depression itself. It can affect the patient lifestyle, like he's not being able to exercise, he's not being able to commit to his medication as well. So yes.
I see. So how are you going to help him then?
Okay, so this is a quite serious here, like because the risk here is if the people has myocardial infarction, depression after myocardial infarction, there is a high risk here. So what we are trying to do is gonna contact Mr. Gray and maybe hospitalized him for further assessment for his symptoms. And we're gonna have to what is the severity of the depression here, and also what is the severity of the disability comes with myocardial infarction. Because this is we're gonna need this for our further assessment management. And after that, we have to do some investigation, blood investigation, workouts, and routine blood tests, and also ECG to make sure what is really cause of this depression. And maybe we could give him some medication like sertraline. Okay.
Okay. Why
Are you
exactly
following me?
sertraline? Why exactly sertraline?
So according to the guidelines, sertraline is one of the best antidepressant for people who are suffering of post-myocardial depression. And this is according to a sad heart study.
1 minute remaining. And any particular medications which we should avoid?
Well, there's some medication we should avoid, of course, like venlafaxine or tricyclic antidepressant, because it could affect with the rhythm of the heart, and the venlafaxine may increase the blood pressure. Yes.
I see.
Would you like to say more about what we're gonna do next in his
Anything else
long-term?
which you feel can be helpful for him?
Of course. For the long-term management, we have to assess the risk. I understand maybe he could be smoking, or he's having any diet, and we could transfer him into attrition. We could also involve our occupational therapist and also the CPN, of course, for his home treatment after his discharge.
Okay.
Okay.
Time. How do you feel about what you did?
I was really stressed.
Yes. Have you ever been to the castle before, Dr. Remia?
No.
Okay. So your anxiety is totally normal because this is a new thing to you, and this is what we all feel whenever we are facing a new situation. But the issue is that you must not think that it ends here. If you want to control this anxiety, this means that you must practice and put yourself in this situation more and more. And with time, you get used to it, and you'll find yourself facing this situation without feeling all these uh, stressful feelings, definitely, which you had during the station. Let's see how you can do it in a better way. Pay attention to the beginning, doctor, your introduction, please. Never mess up with the names. Again, pay attention to this. You'll always have a paper in your hand and a note, and the first thing you write down in this note is the task and the patient's name, and if there is any other associated names like a student name or anything else, but always try to give a good impression in the very first 1 to 2 minutes. Okay, so let's see according to these notes. Now, there is another scenario in which you are going to have a patient who have a lot of stresses, which you should include in your management plan, like being a teacher with demanding job, chest pain, and he is also having cigarette smoking and drinking beers, no exercise, and a lot of details regarding his unhealthy lifestyle. Okay. Post-MI depression, post-myocardial infarction, yes, it is a mood disorder affecting 20%, which you did say. And it often, if you want to add cherry on top and say that you are professional, you must say that it often goes unrecognized. Only 10% of the patients are diagnosed, and this underestimation is attributed to the atypical profile. Okay. Could there be any other use? Yes, there can be, as you said, a relapse of his depression or as a part of the adjustment disorder. However, because of the close temporal relation and the high prevalence, most probably it is a post-MI depression. Can MI cause depression? Myocardial infarction causes depression because, as you said, there are not because of the brain insult. As you said, brain insult. Possible reasons that stress cause increase in cortisol hormones, which are, and there are inflammatory chemicals. And also there are some contributing psychological factors like life existential crisis and feeling helpless and hopeless and unable to enjoy the life as before. So these are factors which increase the chance of having depression. Can depression cause MI? So this is the answer for if myocardial infarction can cause depression. Now we are going to answer the question, can depression cause myocardial infarction? You answered it in a very good way. Yes, there are some contributing factors like the associated sympathoadrenal hyperactivity, the platelets activation, which is, as you said, a thrombo, I don't know, you said something like high coagulation, something like this, and the inflammatory proteins, and also the myocardial ischemia in relation to stress. Okay, these are factors which makes the patients who have depression are more prone for myocardial infarction. How can I help him? Once you start talking about the management, you must be very organized. The first thing which you start with is you want to do your formulation. So what is the psychological condition and level of risk? This patient has post-myocardial infarction, depression, and carries high risk on himself if it is not managed properly. All this in the background that he has recent myocardial infarction. He is not involved in his rehabilitation program, and also there is history of depression and is on an antidepressant. Regarding his social life, we need to know more about his lifestyle and stresses. So, in short, the formulation, as we said, is two lines. First line is to talk about the main psychological problem and the level of risk. The second line is to mention the important information which you know or you need to know in his biopsychosocial risk profiles. Now, the management, when you reach the point in which you are going to talk about the management, make sure that you are very organized in order to make sure that you don't miss anything. So the first thing is what Dr. Lamia is going to do and where the patient is going to be treated. So what you are going to do is that you want to follow Mr. Brown more frequently in the clinic to do regular physical and mental states. Okay. In addition, you must explain to him the diagnosis, address his concerns, and you must ask him what could be the possible reasons for his non-engagement. When you say this, you give the impression to the examiner that you are engaging your patient in your diagnosis, and the patient is there when you are taking your decision. Okay? Are you with me, Dr. Lamia? You must talk with your
Yes,
patient in order
definitely.
to know the reason behind his non-engagement. You want to know what's going on. Ideally, he should be followed at home, not in the hospital. So this is a case in which he should be followed at home. However, if you feel that there is high risk, the admission to the hospital might be considered. Okay, doctor? So ideally, this condition should be treated at home. He should go to his rehabilitation program, follow up with his cardiologist. However, if with the follow-up you feel that there is high risk, you might consider the admission. Okay, regarding never talk about the medications before talking about the investigations. And when you talk about the investigations, please don't talk about the investigations in general. We do some blood tests. No, make sure that you mention the important blood tests which you really do, like liver function, kidney function, blood chemistry, heart tracing, and so on. And in this particular case, you must make sure that you must do what? Coagulation profile and INR tests. And this makes a lot of difference between the candidates who do this station and mentioning this particular point, because you are going to give him a medication which will affect his coagulation profile. The SSRIs affect the coagulation profile. Are you with me, doctor? Okay.
Yes, doctor. Yeah, thank you.
Then you must mention the team. This is a very important sentence to say to show that you are going to follow up your patient comprehensively. A team will follow up all his needs, biopsychosocial, okay, physically, psychological, and social. Physically, you must say that you are going to liaise with the GP. Very important. I did not hear it from you. To discuss the condition of Mr. Brown and the medications which will be used. Okay, must mention this. This is a medical condition, so you must liaise with the physician or the GP. You must make sure that his physical condition is going to be included in your mind, and you are going to liaise with a physician or the GP. Psychologically, as we said, the SSRIs, and you said that it is better to avoid, very good, the tricyclic and the venlafaxine. Okay, and it is very important to mention here the talking therapy. Very important to give these types of patients the appropriate talking therapy. As we said, that part of the reasons or the causes which can be there for the depression is the existential factors and how do they cope with this severe stress. Okay, when we talk about the social approach, lot to say, lot of things to say. There will be involvement of the social services. Someone who has a heart problem, definitely the occupational therapist must be involved. He must have a very good idea about his lifestyle and involve a dietitian if needed. And he must be involved in the subsidized gym under supervision of physiotherapists. So this is a patient who will not go to the gym without the supervision of the physiotherapist. And if there is any problems with cigarette smoking or alcohol consumption, you must involve the alcohol and substance use. Okay? Pay attention to the feedback, doctors. This particular station usually come very important. And as you can see, if you pay attention to the information, most of them you are well acquainted with. I hope that you found it helpful, Dr. Amia. Very, very good for someone who had never been to the class before, by the way. Okay, thank you so much. Who would
Thank you so
like to
much,
go
Doc.
next?
Thank you.
Assalamu alaikum, Dr. Sarah. So what is your
وعليكم
station?
السلام دكتور.
Yeah.
سكيزوفرينيا and cannabis.
Please, doctors, please mute your mics if you don't mind.
Okay, okay. So, hello.
Yes, I can hear you.
Yes, I'm ready, Dr. Hassan. What's the name of the patient? Martin. Okay.
Oh, yes, my name is Martha. Okay.
Yeah.
One.
Just a minute,
Okay,
Dr.
okay,
Hassan. My baby.
okay.
Sorry. I'm really sorry,
No
Dr.
problem.
Hassan.
No problem. Okay,
Okay, I'm
you
ready.
start the- okay. 1, 2, 3, go.
Hello, I'm speaking to Martin.
Yes, yes.
Nice to meet you, Martin. My name is Sarah. I'm the secretary working here. Martin, my understanding that your GP is quite worried about you, and I have been also have a chat with you about that. Is it okay?
Well, yeah, no problem.
Okay. So, do you mind to share with me your difficulties? What's wrong with you?
2 weeks ago, I started to hear voices, and also I feel that my colleagues at work are not good with me. And I think that they are influencing my manager and sending messages by the way they park their cars and stuff. I discussed this with the GP.
Okay. So, it seemed to me you are going through a very difficult time, and you told me that your colleague in the work, they doing something against you. Would you mind to tell me
Yeah,
how did you come to this conclusion?
well, because I've noticed that when they park their cars in a particular way, they have a particular attitude, and when they park their cars in another way, their attitudes changes, and it is always like this. So definitely there must be a link. I'm sure of this.
Okay. So you are quite sure about that. Sorry, Dr.
Yeah.
Hassan. Hassan,
Yeah.
sorry,
Okay,
my
no
kids.
problem. Okay, no, we all have
Okay.
kids, no problem. So you can continue.
Okay.
Please continue. One, two,
So
three.
okay. So you told me that you're quite content about that.
Yeah.
Okay. So since then, how are things progressing?
Well, I think it's been progressed that they are now controlling my manager. I think that also my manager has changed towards me. They are influencing him.
Okay. Okay. And apart from your college, anyone else want to harm you or influencing you?
No, mainly my colleagues.
Mm-hmm. And you told me that you hear voices since 2 weeks ago. Can you tell me more about these voices?
Well, when I go home, I can hear them talking with each other, that saying that I must not continue with them. They want to bring someone better than me. But
Okay. And these voices commanding you to harm yourself or to harm anyone?
what?
Did these voices commanding you to harm yourself or anyone else?
No, no, no.
Okay. Before these 2 weeks, how are you doing?
Well, everything was okay, but you know, I felt that there is something wrong until I noticed that they are putting the cause in a particular way.
Okay. So, Mr. Martin, I get that you have been diagnosed with schizophrenia and you take olanzapine. Have you stopped your
No,
medication?
I stopped it long time, about 3 months ago.
Okay. Can you please tell me why?
Well, I beg your pardon. You know, it affects me because, you know, with my girlfriend, I feel that I'm so weak, so I don't prefer taking it.
Okay. What do you mean by so weak?
Well, it affects my ability, you know, as a man, if you don't understand.
Okay, yeah. I would like to reassure you. Our conversation is totally confidential and no one can disclose any information unless there is risk for you or for others. I hope that reassures you.
Yes,
Okay.
okay.
So you start to feel this sexual problem after taking olanzapine or before?
Yes, with after taking olanzapine,
Mm-hmm. And what's the exact problem that you are having?
yes.
Okay. And how do you cope with this or with all this going on?
The only thing which helps me to calm down is to take a nap. It calms me and make me feel comfortable.
Okay. Okay. And do you have any physical problem? Should I worry about it?
No.
Okay. Any stress around you apart from what you told me?
No.
Okay. Any support?
Yeah, I have my wife and my kids.
Okay. Okay. Do you have any concern regarding your safety?
No, but you know, I feel I'm not comfortable with my colleagues.
Just you have concern regarding your colleagues. Okay. So just recap, Mr. Martin. It seemed to me from what you told me, your schizophrenia symptoms is relapse because you stop taking your medication, and that can carry a potential risk if not treated well. And taking in consideration that you are taking cannabis to cope with that, you didn't have any physical or psychological problem. So is it okay to discuss with you how we can help you?
Okay, no problem.
Okay, so first of all, we're gonna see you in our clinic to assess you regularly, and we need to work collaboratively with you. For that, you're adopting holistic approach in order to help you.
Okay.
Okay, and we're gonna do some blood tests to make sure that you didn't have any physical problem, and there's a special test that related to your condition. It is a hormone called prolactin. It is hormone which is responsible from production of the milk in our body. So we need to make sure this hormone is okay.
Okay.
And if there is any problem here, we can address, the physician will address that.
Okay. 1 minute remaining.
Okay. In terms of your medication, are you settled on olanzapine? So how do you feel about continue olanzapine?
Well, I feel that if there is any other medication, it will be better.
Okay, so there is other medication called aripiprazole if you don't want to continue olanzapine. Is it okay?
Okay, no problem. If it will be helpful.
Yes, it will be helpful, yes. And this is in short term. Also, we can address the cannabis and drugs and alcohol units to help you with your cannabis use. Is it okay?
Okay.
Okay, and after you settle down, we're gonna offer some talking therapy in terms of CBT. Okay.
Okay, no problem.
Also, we're gonna consult the occupational therapist to address your workplace and your sick leave. Okay.
Okay.
Okay, and also there will be a psychiatric nurse who will follow you regularly to make sure that you are taking your medication and you're doing good.
How
Thank
do you
you.
feel about what you did? Very good, by the
I'm not
way.
sure
And
because
bearing in mind that definitely you have kids, I wish that they are in a very good
yes,
position.
a lot of
They are annoying
interruption.
you, but really thank them. Definitely they are nice kids. But all in all, it was very good. But pay attention to it. So when you talk about prolactin, I just say that it can be behind prolactin hormone to a man. Just say that it is responsible for the production of milk. Better to say that it can be the reason behind your problems. Okay, and it's common to be
Okay,
increased by
yes.
our medications. Okay,
Yes, yes.
when you talk about the
Yeah.
medications, ask him. So, any particular medications which you felt good with? Okay, this is how you start. So, how do you feel about taking olanzapine, bearing in mind that it has improved you as before? We can give you another medication
Yes.
with it which can help you, like sildenafil. I will
Yeah.
share with you my screen because talking about it. But all in all, it was good. I liked it.
Thank you.
Okay, so let's see. Okay, very good. As we say, always say, doctor, when you go to the exam, you must have a stepwise approach in order to make sure that you are going to finish the task in 7 minutes. Your introduction is very important. You must gather the biopsychosocial information and level of risk because your management plan and your formulation depends on them. You must explain the condition to the patient, and definitely the formulation and management are considered to be one unit. Never forget them. Okay. So in the
Okay.
beginning, you
Yes.
want to, and this is considered to be a complex task. You are going to gather some information and take brief history before going through the details of your management. So you must, in the beginning, gather the biopsychosocial information and level of risk psychologically. You are going to take the complaint and the symptoms of the syndrome, which is schizophrenia. Now he has as you want to know exactly when did all start and is it increasing with time? And when you ask about the onset, it was very clever by expected from you to ask some just close-ended questions. So were there any stresses? Were you taking any medications? Did you take any street drugs? The closed-ended questions will definitely sort out the whole problem for you. So when you take the complaint
Yes.
properly, ask before the onset and ask specifically about the reasons of relapse, like stopping the medications, stressors, and the recreation drugs. Then the symptoms of the syndrome, ask her about the delusions and the persecutions which she did. So this is the first information which you gather. You want to know the psychological part. Then the social part, the social circumstances, medical part, as we said, physical symptoms, and then level of risk. Can I take and ask him a few questions about the cannabis intake, if he's taking any other medication, any other recreation drugs, thoughts of confronting his colleagues, and thoughts of harming himself. So the important point here is you didn't know exactly how much he's taking. So I'll give me when I say I'm taking cannabis. Well, this is interesting. Can you tell me more about this? Give him an open-ended question. Let him talk. Okay, and then ask him to close the end because you saw how many cigarettes per day are you taking, and since long, how long? Okay, then you explained everything in a very good way. Okay, then your formulation, as we said, the formulation is that or as we said, two lines. The first
Schizophrenia.
line in which you mentioned the most important, the main psychological problem, the level of risk. Then the second line are the biopsychosocial risk information. Okay. Then management, what
Yes.
Dr. Sarah is going to do and where the patient is going to be treated. You must follow him up regularly in the clinic. You must say this, I'm going to follow you up more regularly in the clinic to assess your condition and address your concerns and do thorough risk assessment regularly. Okay. Investigations, you must, yes, you said, I think you said you did, and prolactin was very
Yes.
good, very important, very good, very good. When you talk about the medications, try to engage your patients. So how do you feel about taking olanzapine again? Bearing in mind that it helped you before, how do you feel about taking it again?
Yeah.
Give him, let the examiner feel that you are engaging your patient in the decision, not giving him orders, okay? So you have two options, either giving him olanzapine with sildenafil or giving him aripiprazole. Very important to give him talking
Yes.
therapy socially. It is very important to engage the social services to understand that he can take a leave from his work and also in the
Yes.
occupation
Yes.
therapy. Okay,
Therapist, yeah.
very good. That's it. Thank you so
Thank you.
much, doctor. Very clever,
Thank
mashallah.
you.
And say hi
Thank
to
you.
your kids. Thank
Okay. Thank you
ربنا
very much,
يخليهم
Dr.
ربنا يخليهم لك ربنا يبارك فيهم. Thank you so
Thank
much.
you.
Very clever,
Thank
mashallah.
you. Bye. Thank
Who
you.
would like to go next? Are we finished? Okay, thank you so much, doctors. It was a privilege for me. Again, doctors, pay attention to the this task, the management task. And there are new stations which they bring, but as long as you have the outline of the task in your mind, you will not face any problem regarding these new scenarios. I will try to arrange and sort out the outline of the new stations, but until then, please prepare these particular tasks more and more. Thank you so much. Have a good night. I hope to see all your names in the post list. Night.
Thank you, Dr.